keeping mental health crises out of the criminal justice system. That's the goal of Dell Medical School at UT Austin, along with Travis County leaders. Now, it's part of this program called the Travis County Forensic Mental Health Project. And joining us now is Dr. Steve Strakowski, Associate Vice President for Regional Mental Health at Dell Med. So, Dr. Strakowski, the goal of this project is to really create solutions for people stuck at the intersection of criminal, legal, and then behavioral health systems. What type of care will this project provide to really achieve that goal?
That's a great question. What we're trying to do is eliminate where the jail is being used as a mental health facility and instead get people placed into more appropriate care, which could involve both inpatient, outpatient, and a variety of other kinds of programs. We really don't want people cycling in and out of jail or sitting in jail waiting for mental health services. The jail really needs to be reserved for the legal process, not for mental health care. And so that's the goal of this project that we're working on.
And I'm glad you touched on that, because a previous KXAN investigation of the state's hospital system shows that it operated at capacity for years, causing hundreds of mentally ill inmates to wait months for a bed and treatment. So that contributes to, like you said, the mental health crisis in our jails and our prisons. Are there some other barriers as well? I know that you also talk about equity a little bit.
We do. Well, first, the jail process is well known in the United States and Texas to be inequitable, and that people of color are grossly overrepresented in our jails and prisons. So we know that's true. We also know that people of color have harder time accessing mental health care, and so that almost creates a perfect storm for this intersection. The Austin State Hospital is one exit point, but we're also looking at ways to not go into jail if there's better alternatives, or to be able to qualify for bail or get assessed more quickly for mental health needs to get you out of jail faster. And so there's just multiple pieces, inputs, outputs, and barriers while people are in jail that slow the process. And we're trying to fix those.
And I know we talked probably about a year or so ago. I know you're on that steering committee for the project, and you all are currently evaluating those existing systems. What actionable items, I don't know if you can touch on this just yet, could we see from this project? And do we have any idea on funding or how much it might cost?
So you're getting ahead of us a little bit, but that's okay. So far, we've started in May, and we've created our steering committee, and we've set some goals and a vision. In September, we're going to launch a 100-day challenge to look at our best options and see what will make the biggest impact per dollar, essentially, or we can improve the lives of the people who are trapped in this intersection. I mean, the costs are, hard to predict because it'll depend on what the county feels like it can afford, but it's often, tens of millions of dollars that other communities have ended up investing in various types of programming and sometimes facilities. And so it's likely that's what we'll end up recommending.
And I'm glad you touched on the state hospital. We know the new Austin State Hospital is expected to be completed in late 2023. How will this aid in the project efforts? I'm assuming you all are working in concert.
We are, since I lead both projects. so in the middle of both. The hope is to use both the hospital and the alternative mental health options appropriately, to not default to Austin State Hospital with everyone in jail, for example, so that we're placing people at the level of care that they need to best utilize that resource. And we think by better allocation of resources, we can help both the hospital and how it's managing people, as well as getting people out of jail when they're being kept there for mental health needs.
Dr. Steve Strakowski, always great talking to you. Thank you so much. Associate Vice President for Regional Mental Health at Dell Med. Thank you again for your time.
Thank you for having me on.
Going in depth now, Travis County jail officials tell us that more than 2,300 are in the jail as of late Tuesday. Now, more than 900 have a mental health designation. For 2 years, KXAN has explored a growing backlog of people in Texas prisons who need some restoration for mental health. We've linked you to all of that coverage in our Locked in Limbo series at KXAN.com.